Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go. Subscribe to Talk City on iTunes, Stitcher, Google Play, or SoundCloud so you can keep up with what's going on in Greensboro City government. I'm your host, Josh Johnson, and with me today, as always, the one and only Rosemary Flyman.
So glad to be here. Thanks so much for listening every week to our conversations. We really hope you're able to catch our last podcast, and we want you to share it. Tell a friend about it as well. Hey, 36 years ago, 14 friends got together in the Triad to talk about the emerging health crisis around HIV and AIDS. Those friends were the start of what is now Triad Health Project. Adriana Adams is the executive director. So glad to have you with us today.
Thank you for having me. I'm so glad to be here.
Okay, let's talk about Triad Health Project. What is it? What are the services you offer?
So we are a sexual health and justice organization. 2 words, or actually 3 that are often not put together. But it's our purpose to make sure that people in our county know about HIV, know about its stigma, its root causes, and then we strive to have a future in Guilford County without HIV. So that's what we're working towards. Rosemary, you did a great job of talking about sort of our lore, how we were developed, but it's true. It's a true story. There was a crisis and some friends saw that it needed tending to, but it hasn't gone away. And right now what we focus on is educating and making sure that people have access to care.
Yeah, it hasn't gone away, but it's changed. And really people's perception has changed. And what we know about it has drastically changed.
Absolutely. Yeah.
Definitely.
So what is the face of HIV/AIDS in our community?
Yeah, that's a really interesting question. So I like to answer that in 2 parts. First being that the face of HIV is all of our faces, right? So it could be a lab tech at Cone Health. It could be a person who's working in our own organization. It could be anyone who looks just like you or me. There are people from every socioeconomic status who are living with HIV. And it's actually one of the beautiful things that has happened in the last 36 years is that people who are living with HIV are now living full, whole lives if they have access to medication. However, what has changed about HIV in, I'd say, the last 10 to 15 years is just like with any other infectious disease, it tends to spread and go to the margins or the marginalized in our societies. We've really seen this with COVID as well. So what are we looking at with COVID and saying, who are we most worried about as far as who's getting COVID and who is keeping COVID? Communities that have other issues as far as barriers and access to healthcare. And so that's what we see even in our own community. Who are the new cases? We just had our first quarter numbers. And when we talk about this, it's not just Triad Health Project's numbers. So we partner with the health department. We partner with other organizations to track HIV. And just in our first quarter, there have been 37 new cases of HIV in our community. And that's up from 2020 numbers, which were around 29 cases, which you think, oh, that's not a huge number difference.
Yeah, but it is significant.
Especially since we have medications that can completely, to over a 99% level, prevent HIV transmission through sex.
That's amazing.
So, and that's a medication called PrEP that we provide free through Triad Health Project. Right. So we would say that the people who are contracting HIV are people who are young, who are men sleeping with men, people who are young women of color. And those are folks who are maybe having a lack of access to education, maybe having a lack of access to tools for safer sex. And that's what we're doing in the community.
Okay, I want you to go back and say what you said about PrEP again, because I think, especially for those of us who are 80s kids, I mean, that is really big news, and you might have missed it. I mean, really, with all the other stuff going on in the world, you might have missed it.
Yes, so it's a medication medication called PrEP. You might see these commercials on TV sometimes if you're watching certain channels. There is a medication, the shorthand is PrEP. It's pre-exposure prophylaxis is what it's called. And we partner with a telehealth agency called QCare Plus. We're their community-based organization partner. And if you go on our website, there's links to it where anyone in our community who can qualify for PrEP. So you'll go through a questionnaire, but anyone can qualify for it, will be able to access this medication that at an over 99% rate will prevent HIV transmission through sex and through intravenous drug use as well. So this is what we want to get out in the community. We want people to know that this is available to them, that you can have access. The other really cool thing, and this is what really gets me really excited because this is intersectional, is that we have been able through our partnerships to partner with another agency called Pride Life. And what they do is if you qualify with certain income levels, we also will provide health insurance to people.
Wow.
Like not just for PrEP, but full on health insurance to people who can qualify for it. And then they can not only get their PrEP medication, but they're also receiving health insurance.
Wow.
And we don't just do this for Guilford County. We are the partner for North Carolina.
Okay. Wow, that's huge.
Yeah.
That's huge. Okay.
huge.
I mean, that's a lot of stuff happening here.
Yeah.
Now, I know a lot of people don't seek treatment. They don't even ask the questions because of stigma and around HIV/AIDS, around STIs. So how do you work to really stop the stigma?
Yeah. So I think the first step and what we try to do is doing stuff like this, talking about sexual health. And those conversations should be starting early. I think when you mentioned being an 80s baby, there was a real fear about talking about HIV in general. And I think, I'm an 80s baby as well. These fears developed when we didn't know how people were getting HIV. But we know now. We know that how you get it, and more importantly, how you don't get it. And so we start with education. So first, it's to talk about sex in general, talk about sexual health, talk about our bodies, and that starts at a young age, and making sure those conversations are being had. And then to talk about and educate people around HIV and other STIs, that this is a general part of their health. If you have a teenager at home and you have talked about sex, and maybe that's a part of your conversation, great job. But if you haven't talked about sexually transmitted infections, then you've missed the mark a little bit there because that's a part of having sex. And not only if you're a teenager or you're an adult and you're not getting regularly screened for STIs, then that's another miss of the mark. And so I just encourage people to talk about it. And then how you do and don't get HIV. So you're not getting HIV by bodily contact, regular bodily contact, like a hug or a kiss or shaking hands. But there are still people out there who believe that. And there are still people who carry that stigma around them that are living with HIV. People who have HIV sometimes hesitate to disclose that they have HIV because people still carry that knowledge or misinformation with them. And, we see misinformation as such a strong thing. We see that with COVID. Even once we found out how you do and don't get COVID, people were still wanting to sanitize their groceries when they brought them home, right? And we know you're not getting COVID that way.
Right.
But people are still doing it because feelings. And so one of the things that we try to do at Triad Health Project is when we get scientific information, we believe that scientific information. And when science tells us something different, we change our thinking around it and we take that on and we say, okay, science has changed and it's told us something new.
Right.
And we understand people have feelings and we acknowledge those feelings, but we have to go with the science. And that's just a really important thing because that's what happened with the HIV/AIDS crisis in the 80s. So I hope that answered your question.
No, I think
it's an important thing
Yeah.
that we're dealing with still to this day
absolutely.
at Triad Health Project.
So what are ways we can support Triad Health Project? What can we do?
So we're a nonprofit, and I am very, very open about saying we certainly need funding. One of the important ways in which our mission has really evolved over the years is that we are focused on prevention. So we do case management for people who are living with HIV, and that is part of our work that's gotten funded throughout the years in some really strong ways. People can recognize that we need funding for that. But one of the ways that's harder is to get funding for our prevention efforts. But it's so necessary. Yeah. We have received some funding from our city throughout the years from the government, but it's a tiny percentage of the testing that we're actually providing for our county. So we have free testing for gonorrhea, chlamydia, HIV, syphilis, and hepatitis C that we provide to the community. And we are doing that 5 days a week. Wow. And we are doing it with a handful of people. Mm-hmm. And so those are things that we need funding for. So if there is someone out there who is connected to this work and they want to give, that would be amazing. Mm-hmm. A big percentage of our general contributions go to support that work. And we're going out to colleges and universities and providing testing and support. We are getting the word out and providing that education that we talked about that helps break that stigma. Yeah. So that's a big thing. The other thing is we can always use volunteers. We have a wonderful place called Higher Ground Day Center, which is a place where people who are living with HIV can come at any point during the week and get a meal. We have a lunch that's served 5 days a week. There are some folks who are part of this community that are experiencing homelessness or houselessness during the week. They can come and find that support, but also just to find a community where it is not a place where they experience that stigma, where someone isn't going to try to give them a paper plate because they're afraid they're going to get HIV from their silverware. And so this is a place that is that community that they can find that support. And that place is a place where someone could come and volunteer, provide a meal. A lot of our faith communities provide meals there during the week. So if that's something that someone's interested in, that would be fantastic. We have a red ribbon walk or run that we do every single year around World AIDS Day, which is December 1st. And people who want to get teams together for that would be fantastic. So that'll be coming up. You'll see stuff about that. And then there's a new initiative we've started. Some people might remember Dining for Friends that we did for years. Yeah. Well, we've kind of transitioned that a little bit to something that we're calling heart parties. Our logo is a heart. Right. You'll see it around. We use it a lot. And what we want to do is make sure that people can really support us in a way that's comfortable for them. So if you're throwing a kid's birthday party and you want to make it into a heart party, you can do that. If you're having a backyard cookout and you want to say, you know what, if everyone wants to throw in $5, $10 and make this a heart party, there is a great link on our website about having a heart party for THP. Anything, any size, from something that might raise, $100 to something that might raise $10,000 is there on our website. That's so cool. Make it a heart party for us, and that'd be great.
There are no shortage of ways to support and to help, and that's
what we're trying to do. And I think that's the key, is that to get connected into what we're doing. Sexual health is human health, and really I think COVID has taught us that community health is about all of us getting involved. One person's health really impacts another.
You're so right.
Absolutely.
All right, the website, triadhealthproject.org.
Yes.
That's where to go. Lots of great information, resources, conversation starters are there. Yeah. So check it out. I highly recommend it. Really, really good place to start and kind of dip your toe before you get into the real work. So thank you, Adriana, for being with us.
Me.
Thanks for being on the show.
Yeah.
Stay tuned in weekly by subscribing to Talk City Greensboro on iTunes, Stitcher, and Google Play. And don't forget, you can download Talk City from SoundCloud.
That's it for this week. Thanks so much for tuning in. Be sure to watch GTN, your official source for news and information about the city of Greensboro. GTN is available on Spectrum Channel 13,
AT&T Uverse Channel 99,
and North State Channel 31.
GTN also streams live on Roku and the city's website at greensboro-nc.gov.